coming on to our today's evening session, and I am requesting Surendra sir to take the class for us. Surendra sir, please.
Welcoming all the elected members for another session of homeopathic discussions. The more the atmospheric changes takes place, the more impact on the body comes in. Even there, the impact on individuals differ. Sir, you say it differs, but all are getting the same cold. Yes, he is getting cold very often, and during adverse impact, he gets congestion in the lungs, accumulation of fluids in the lungs, whereas you don't get it. The difference between both. Why? Because here also, the human tendencies, habitats, the area of living, everything comes. That's what we call it as atmospherical phenomena. Yes, whatever we sound there, the resultant process is you receive, you resist, your body resist, your vital force resist, but some succumb to this problem. Why I am telling you is there is lots of news, a peculiar phenomenon that will go up to March, because sun is moving away from the earth. That's what we call it as Dakshinayana, Uttarayana. So during this changes, more cold and less sun rays will be on the earth. You may ask me, if that is so, why should this California or San Francisco or California fires come in? That we cannot answer it, because it's only a particular area. Overall, no such problem. Only during the summer season, if the forest fires comes in, we can give the answer to that. Okay. This is only about general things. So I have given medicine to person. Either based on symptomatology or total symptomatology, I have given one medicine, or I have given medicine, concomitant medicine that follow well, which is required. I ask them to repeat it. One medicine today, the other medicine to be taken the next day. He feels better. Though the medicine is very little, quantum is little, when he feels better, he should discontinue. That is, you yourself will assimilate the tagging and ask him to stop the medicine after 3 days. Telephone to him, ask him to telephone the physician, report the matter, and then after the instructions he can continue. That is not the case in the modern days, modern medicines. They give prescription for 1 month to 2 months like that. What happens in between? The patient gets troubles or help. All those things depends upon. Let the healthful progress of the cure be interfered with taking too much medicine. In other words, if you give medicine 3 doses a day, 4 doses a day, continuously for 5 days, 10 days like that, what happens? There's a progress, then your own medicine that are given after the progress, after the betterment, that upsets and again the trouble starts. That is, 2 things may happen. The same problem may reoccur, or the symptoms may be altered. Here, you please follow this carefully. I give medicine. I know this condition, chronic, acute, as the case may be, and portion the medicines accordingly. That is, I have prescribed the medicines accordingly. Then what happens? There is a prognosis, betterment, cure. Medicine should be stopped. Sir, how do patient know? He is there outside. He cannot come any time to you. That is why we have an rapport with the patient. You please telephone to me after a week. Keep the medicine. I will tell you how to take. For example, we are given Midolinum 200 followed by Prostaxin Bryonia. Midolinum 200 you are given to be taken on first day of the week, or put the date put the dates. After 2 or 3 days, he takes Prostaxin Bryonia alternatively for 5 days, 10 days or 3 days. You ask him to report back after 15 days. He says he feels far better. Then you you must immediately stop the Midori, the moso. The Midori and the moso paved the way, that is, it has removed the obstacles. Thereby, Rostocks and Bryonia penetrated into the muscles and bone and helped the patient. So he feels better. Alright. When he telephones, what do you say? You stop the first medicine. You take the second and the third medicine alternatively for another 15 days. That's all. That's all.
Automatic.
Then what happens? You ask him to come back. You study the case again. Here, what your thoughts and ideas should be, whether I should bring back the door again. That's according to the condition of the patient, because it is called a second prescription. A second prescription. That will help you to make the cure continuous. There is no going back on the change of medicine. Assuming for a moment, you get some other new symptom, or we know as it is, the homeopathy will bring back the hidden symptoms. So if those things can be, you have to give medicine according to the conditions prevailing in that. Shall I discard Rostocks and Bryonia? No. You have to continue Rostocks and Bryonia and give the other medicines like pain and other symptoms where arnica can be helped. Arnica will help. Or some other medicine according to the symptomatology. For example, he feels weak. Give him bio number 16, nervous exhaustion. Or he feels constriction. Give corticum. Like that, the chain must be there so that there will not be reoccurrence of the old conditions or old position. He should not come back to that. If he comes back to that, the patient will lose faith in you. No, he has given me medicine without. I had some cure in 15 days. Again, what happened? I came back to square one. That is, he is suspected to make money, doctors making all this gimmick, because the people are more clever than the physician. Not that physician has got the tendency. It is only aimed to cure. When that is the matter, you must be very careful in your prescription. Yes. Then comes one more aspect. Welcome. Premature repetition or changing of remedies before the reaction is finished does endless harm to the patient. What is the difference between the earlier statement or earlier clarification and the present clarification? Premature repetition. For example, you are given Medorinum. It will act for nearly 2 to 3 days. So you are given 2 days gap or 3 days gap at the treatment. But you ask him to take it every 2 days, it will be a premature repetition. Because action of the drug is also to be considered and to ensure that the drug action is not hampered or disturbed. If that is done, then the prognosis of cure is obstructed. So, it becomes endless harm to the patient. Not only that, it will also confuse the prescriber. Who is the prescriber? You are ourselves. Because you have not observed the rules. You are asking to take according to the very, very bad condition. You are asking to take Medorin every day. Your assumption is wrong. The prescriber must know when to give remedy and when to hold his hand. When to give the remedy, when to hold his hand. In other words, what is the gap that he should give? While the nature expedites the forces to which he has given a new direction. Because when Medorinum is given, it goes and paves way for removal of the obstruction. That is, either soda, probably soda case. Then the condition becomes a new direction. You are foreseen that this is a case where after the Medorinum, Restax and Bryonia should be followed, because you are very sure that his condition requires that. There's a chances of failure of 1 to 2% here also. Here also. When Medorinum is given, you are given the gap. He gives a new direction. His condition becomes a new direction. When Restax and Bryonia is alternated given to him, the prognosis is effectively done. Then it's a hint for the physician, the prescriber. He must know the power of sacral and remember that an inward movement of symptoms bodes no good. Power of sacral. During olden days, used to all homeopath prescribers used to packet the pills. They put lactose powder, lactose nothing but starch prepared from cow's milk, that too from Finland and Western countries, where their power is very thick, milk is very thick. There, with that, we put 4 homeopathic pills and packet them. We packet. In between, we give saccharine, that is, put lactose, put empty pills, then packet it and member them. You take midorrhinol 1, then saccharine 2/3, then Rastox 4, then Bryonia 5. Like this, it was continued. That's how we are able to give this saccharine tablets. Yes. I will continue this with another interesting class. I think you all enjoyed the observations. Thank you.
Thank you.
Anup sir, நீங்கள் எடுத்தீங்க.
Thanks. So today we will discuss prostate gland. Prostate gland anatomy, physiology and pathology. In this, I think the anatomy part may not be very interesting for all of you because it's not going, you are not going to do anything much, but we will rush through that soon and then see the homeopathic side of it, how to treat the problems of them. So definition of prostate gland. Prostate gland is a fibromuscular organ. So it is fibromuscular organ means there is fibrous tissues and muscular tissues are on that, and fibromuscular and muscular granular. So fibrous tissues, muscular tissues and granular tissues are also there. So the granular tissue is what is making the prostatic fluids. The muscular and the fibrous are holding shape of the gland. The fibromuscular granular structure situated between the neck of the bladder and external urethral sphincter and surrounded by prostatic urethra. So, the prostatic urethra means the urethra passing through the prostate gland, and it is surrounds the prostatic urethra. It is conical in shape. Normally, it is conical in shape. When it is enlarged, its shape changes its shape. Prostate gland is located just below the bladder in men and surrounds the top portion of the tube that drains urine from the bladder. So that is the urethra. It surrounds the top portion of the urethra. Prostate's primary function is to produce the fluid that nourishes and transports the sperm. The seminal fluid is produced and seminal fluid nourishes and transports the sperm. So this is how the technical diagram looks like. You can see the bladder. This is the bladder, and from the bladder there is a tube passing down through the to the penis to the external opening. So the neck, at the neck of the bladder, the prostate gland is found, and the urethra passes through the prostate gland. So when there is a problem, it squeezes the urethra and urine won't flow down. So the anatomical part, we will make it quick. There are 3 surfaces for the prostate gland: anterior side, posterior side, and 2 inferior lateral. That is, inferior lateral means lower side, and 2 lateral on the lateral portions. So that is how it is. The anterior side, posterior side, and 2 inferior lateral surfaces are there, and the lobes are there. 5 lobes are there. It is called anterior lobe, posterior lobe, median lobe, and 2 lateral lobes. The size is about 3 centimeters vertically, 4 centimeters transversely in the base, and 2 centimeters anterior posterior way. This is the normal size. But when it enlarges, it will be totally different. We will see it later. So This is the median lobe, the anterior lobe, and through that the ejaculatory duct passes, and then it joins the urethra. So this is how the seminal fluid enters the urethra. So lateral lobes are there, and the prostatic ducts are seen here. The prostatic urethra is the small opening through which the prostate gland gives way to the urethra. This is the basic technical diagram, which will be of just interest to some people only. So now the weight, normal weight is 15 to 20 grams, and the adenoma usually occurs in the median and lateral lobes only. It never occurs in the anterior and posterior lobe because they are mainly fibrous and muscular tissues and devoid of any granular structures. So adenoma usually occurs in the medial and lateral lobe, which is glandular structure. Facial relations, the prostate gland is related to 2 capsules and 1 fascia behind. We will just skip the anatomic part because it will not make much sense. Physiology of prostate gland. The testicular hormone relates to prostate gland. So testicular hormone is related to prostate gland. Prostate testosterone is secreted by the Leydig cells of testis, and in the absence of both the testis or the testicular hormones, prostate gland fails to develop. So if the testis is not there or testicular hormones are not there, prostate gland stops development. So this is one of the things which you should remember. So prostate gland cancer patients, doctors remove the testicles. That is one of the surgeries what they do. Prostate secrete a specific fluid, that is prostatic fluid, which provides 10 to 20% volume of the ejaculation. So the semen what is discharged, in that 10 to 20% will be the prostatic fluid. It contains prostaglandin, an enzyme, and acid phosphates. It has antibacterial properties which help to prevent urinary tract infections. So this is the total information about prostatic fluid. It is almost 20% the volume of the ejaculation. The semen ejaculated contains prostaglandin enzymes and acid phosphates, which is antibacterial property, and it prevents urinary tract infection. Prostate gland also secretes glycoproteinaceous fluid, which is known as the prostate specific antigen. So this is important to know. Prostate specific antigen. The prostate specific antigen actually liquefies the semen and allows the sperm to swim freely, and it is best tumor marker for prostate gland cancer. So the function of prostate specific antigen is to liquefy the semen and allow the sperm to swim freely out of it. And it is the best tumor marker. This means tumor marker means if the amount of prostate specific antigen increases above the normal levels, then we can suspect a tumor in the prostate gland. So that is how the blood test will specify whether there is a cancerous tumor developing or a benign tumor developing in the system. So normal value of prostate specific antigen is the 4 mn, the 4 NMON, that is 4 units is normal, less than 4 units is normal. 4 to 8 is benign prostate hyperplasia, that is the enlarged prostate. So 4 to 8 will say it is benign prostate hyperplasia. 9 to 10 shows diagnostic benign prostate hyperplasia and suggestible for cancer. If it is 9 to 10, then the doctors can suspect it is a cancerous stage, and more than 10 is suggestible to be a cancerous tumor in the prostate gland. So this is the thing. So when the prostate PSA is above 10, then it is a high chance that you have a prostate gland cancer. If it is less than 4, then you are normal. If it is 4 to 8 means your prostate is enlarged. Benign prostate hyperplasia is a histological pattern of prostate characterized by the proliferation of smooth muscles and epithelial cells within the prostatic transition zone. This may lead to prostatic enlargement. So benign prostate hyperplasia means the enlargement of prostate gland is a cellular pattern, a histological pattern of prostate gland characterized by proliferation, multiplication of smooth muscles and epithelial cells within the prostate zone, the transition zone, the area where the prostate gland is there, the cells multiply and lead to prostatic gland enlargement. It is considered as normal part of aging in men and is hormonally dependent on testosterone and DHT production. So this happens normally when the people get older and the testosterone levels come down. The enlargement of this prostate gland happens normally. 50% of the men develop benign prostate hyperplasia by the age of 60. At 60 years of age, 50% of the people men develop this enlargement, and 90% by the age of 85. So after 85, everybody will have this. 90% of the people will have this prostate gland enlargement. So this is something which men normally cannot escape. So this is the diagram to show how the prostate gland, normal prostate gland and the bladder is. So that you can see the bladder is like a funnel shape. All the urine what is collected here is allowed to flow down freely without any hindrance through the prostate gland, which is the section is shown here, and center as a whole. So this is a normal one, and when it is enlarged, when the prostate gland enlarges, it pushes the bladder upwards, and now you can see there are two pockets available here where the stale urine is retained, it is not emptied fully. So whenever you go to urinate, the full bladder is not exhausted, like evacuated like what we have in the younger age. There will be the enlarged prostate will be pushing the bladder upwards and changing the shape of the bladder, and also constricting the urethra which is passing through that. So in two ways it is obstructing the passage of urine, like by pushing it upwards and also constricting the urethra. Causes: it is involuntary hyperplasia. It is an involuntary hyperplasia due to disturbance of the ratio and quantity of circulating androgens and estrogens. So it is basically a hormonal change, deformation, and that is because the androgens and estrogens balance is not maintained. Benign prostate hyperplasia is benign neoplasm called fibromyalgia. So it's a fibromyalgia, and it's a benign neoplasm. So it's not cancerous. With age, thyroid stimulating hormone levels drop. So when the thyroid stimulating hormone level drops, but the fall of estrogen level is not equal. So estrogen level is high and the thyroid stimulating hormone falls low. So prostate enlarges through intermediate peptide growth factor. So when these conditions are conducive for them, the peptide growth factor will be induced, and the protein will start, the cell multiplication will start there and becomes enlarged. It's a natural process because of hormonal imbalance. Benign prostate hyperplasia arises from the submucosal gland of the periurethral transition zone with stromal proliferation and ethnosis. So this is all technical terms explained how the enlargement happens. It eventually compresses the peripheral zone and enlarges the lateral lobe. So when the multiplication and proliferation of the cells happen, it enlarges and as a lateral lobe. Benign prostate hyperplasia arises from subcervical glands of the central zone, enlarges as a little lobe projecting the bladder, projecting up into the bladder. So as I said, the growth will be pushing up the bladder upwards, and the shape of the bladder changes, and it will now start retaining the old urine, and full evacuation is not happen. So the common symptoms of enlarged prostate gland is weak urine stream, because I told you the urethra is creased, so the flow cannot be as good as when you were young. Then the weak urine stream, the stream of urine will be very weak, it will not have the power to fall very far from your body. Difficulty in starting urination. So So even if you want to go and pass urine, you will be standing there or sitting there and expecting the urine to pass, but it will not come immediately as they wish. Difficulty in starting the urination. Next is stopping and starting. Stopping and starting while urinating. So while passing, it can stop and then it will start again, because when you apply pressure, it comes out, and when your pressure comes down, the urethra can close off and stop the flow again. So you have to put pressure again. Then after urinating, you will feel dribbling at the end of the urination. After urination, you stop urinating, then you still feel there are drops of urine still coming out, flowing out without control. So it's called dribbling at the end of urinating. Then strain while urinating. So you have to apply a lot of pressure, strain yourself to urinate. So these are the common symptoms of enlarged prostate. Increased frequency of urination at night, nocturia. This is because you are always not evacuating fully, and the bladder seems to be full all the time, and it's not because it's not completely evacuated. The small quantities of urine is enough to make you feel full. So and especially at night, you feel more urine in the bladder. So the urgent need to urinate will be there. That is, you cannot hold the urination immediately as you feel you want to urinate. Frequent need to urinate, not being able to urinate. That is one more thing. Blood in urine, hematuria, urinary tract infection, pain in the perineum area. That is, perineum is the area between the anus and the scrotum, which is often made worse by prolonged sitting. So this pain will be there. Then pain in the pelvis and genitals, lower back and buttocks, pain when ejaculating. So these are the common symptoms of enlarged prostate. Next is how the doctors examine. That is per rectal examination. That is, through the rectum, a finger is passed through, a glove finger is passed through, and the doctor feels the prostate gland. The size and shape of it is felt, and depending on whatever doctor finds, he will report it like that. Like the size, the upper pole is easily reached. That means when he touches, he can touch the upper pole without difficulty. With difficulty or not reachable. So it is reached with difficulty or not reachable. That is the three things because of the size. Next is consistency. Rubber like soft, firm, hard. These are the versions what he can find out. Rectal mucosa, gliding or fixed. So when he moves the finger up and down, if the mucosa, the rectal lining is freely is moving or is fixed, that means if the cells have started growing onto the rectal area, it is a danger thing. So rectal mucosa is free from the prostate gland. That means that both are separate as required. So it is not fixed, it's gliding. Then the surface is smooth or nodular. If the surface is smooth, is one condition. Nodular means there are no uneven growth on the top of it. Then tenderness, absent or present. If it is, when he touches, pain is there, or pain is not there, absent or present. Then the median sulcus, that is, there is a feeling the median sulcus is probably palpable or penetrating. So the median there is a curve on the organ. If that is feelable and it is prominent, if it is palpable or it is obliterated. These are the things what they will observe in the rectal examination. So next is by rectal examination. If the upper pole is easily reachable, it's called grade 1. Upper pole not reachable with difficulty is called grade 2. And if it is not reachable, it's called grade 3. By weight, if it is 18 to 20 grams, it is normal. Up to 25, it is grade 1. Grade 2 will be above 25 up to 50, and the grade 3 up to 70 grams will be grade 3. Grade 4 up to 80 grams, and up to grade 5 is 80 grams and above. So these are the technical specifications for the enlarged prostate gland. Changes in the urethra. Enlarged prostate gland, prostatic urethra. So enlargement of prostatic urethra. So prostatic urethra can get enlarged. Exaggeration of normal posterior curvature of the prostatic urethra. urethra compressed laterally, reducing the anterior posterior slit. So these are the changes in the urethra because of this enlargement. Changes in the urinary bladder, compensatory hypertrophy of the vesicular diffuser, then thickening of the bladder wall, hypertrophy of the trichor, that is, I said that the funnel shape is gone, then formication and of the diverticular, that is, formation of diverticular. The diverticular means two pouches are formed, then formation of pool of residual urine, cystitis and calculus are all formed because of this urine there. Somebody's mic is on, please switch off. Changes in the urethra and kidneys. Somebody's mic is on, sir, please switch off. Hydrouretic.
So you are also muted, sir.
Muted.
Hello?
Hello.
Okay.
Anup sir, no voice. Anup sir, no voice. Anup, no voice.
Your mind is moved, sir. Don't be. Your mind is moved.
Okay.
Yeah, okay now.
Can you hear now?
Yes. Yes.
Okay. Right. So, vesicular reflex, a condition in which urine flows backwards from the bladder to one or both ureters and sometimes to the kidneys. Then chronic pyelonephritis is a bacterial infection causing inflammation of the kidneys. This is how after the benign prostate hyperplasia, the prostate gland gets enlarged and the changes in the bladder. So these are all depicted by the picture. It retains urine and will have all the troubles. You can see because of the urine retention, there is a stone also formed in the kidney, in the bladder. So again another picture. So prostatitis is the types of prostatitis. It is acute or chronic. Acute prostatitis will be the causes will be due to instrumentation, and the causes will be bacteria involved. E. coli, Yersinia and Proteus. 3 bacteria are involved. Ascending infection from below. Staphylococcus will be the bacteria involved. Hematogenous prostatitis. Staphylococcus pyogenes is the T. salis is the cause, and descending infections because another bacillus infections are there. Pain and frequency, fever and chills and rigors will be there. Retention of urine will be there. Perineal heaviness, pain on defecation. Tender prostate and rectal examination. Initial fractions of urine is turbid, which is sent for culture and sensitivity tests. So these are the tests whatever we do for that. Chronic prostatitis will have E. coli, Staphylococcus, Streptococcus, Trichomonas and Chlamydia. They are always associated posterior with urethritis. Epidermitis, inflammation of the coin tubes called epidermis, and it's at the back of the testicle. Pain in perineum, rectum, and lower back of the leg will be having pain. Fever will be there. Sexual dysfunctions. Per rectal examination shows tender prostate gland. Prostatic fluid obtained by prostatic massage will show 15 or more pus cells. Prostatic abscess is one of the issues which can which can affect the prostate gland. It's an infection, separation and pus formation in the prostate gland. Presentation is fever, rigorous, perineal pain, urinary disturbance and tenderness. Soft fluctuant swelling. The swellings can be fluctuating and in the prostate, and the rectal examinations will show. Often presentations may be retention of urine, total count will be increased, urine will show pus cells. Ultrasound diagnostic examinations will show the perineum will be the ultrasound often done over perineum also. Treatment is antibiotics, ultrasound guided aspiration, transperineal lithotomy with the stone formation, and transperineal incision and drainage is the treatments. The suprapubic cystostomy is better in case of urine retention because the urine will not drain fully properly. After drainage, antibiotics are needed for a longer period for 6 weeks to prevent recurrent infections. Then there is bladder outlet obstruction. It's another problem. Bladder outlet obstruction. It is the low urinary flow rate with the presence of high volume pressure and urodynamically controlled entity. It is diagnosed by urodynamic pressure flow study. The flow rate will be less than 10 mm per second. Volume pressure will be 80 centimeters of water. Eventually, due to that is the bladder muscle is inefficiency. Bladder muscle inefficiency will be shown, occurring significant residual urine because of the pressure and inefficiency of the bladder muscles. There will be urine retention. Causes of bladder outlet obstruction: benign prostate hyperplasia that we have already known by compression of the urethra, bladder neck hypertrophy or stenosis, carcinoma of prostate urethral stricture function, then bladder neck obstruction. So these are the causes of bladder outlet obstruction. Effects of bladder outlet obstruction is acute retention of urine, chronic retention of urine, impaired bladder emptying, uremia, infection, stone formation, hematuria. Then the examinations will be ultrasound, renal function test, intravenous urograms, prostate specific antigens are in investigation methods to find out. Management is by treating the cause by cystoscopic bladder neck incisions, ureterotomy, then transurethral resection of prostate. It is a most common malignant tumor, that is carcinoma of prostate is the most common malignant tumors in men over 65 years. Carcinoma of prostate occurs in the peripheral zone in the prostatic gland proper, that is commonly in the prostate lobe, posterior lobe. So the prostatectomy of BHP does not confer the protection against the development of carcinoma of prostate. Incidence of prostate cancer in men over 80 years is 70%. So after 80, there is a chance of 70% chance of all men getting this problem. Microscopically latent tumors incidentally found by transrectal ultrasound guided prostate biopsy or by PSA examinations. Early localized carcinoma, advanced local prostatic carcinoma, metastatic carcinoma either in the bone or commonly on other organs. So this is the stage where the cancer already spread outside. Histologically, there will be adenocarcinoma wherein there is loss of epithelial cells layers, which is normally surrounds the prostatic gland, and glands here appear to be in conflict, that is, they will be fused together. Grading the carcinoma is based on the differentiation as per proposed by Nielsen. So these are the stages. That is A first stage, then there will be cancer slowly developing, then it is multiplying, and you can see it is a fully staged cancer developed within the prostate gland. Now we will talk about our subject, that is homeopathic treatment. So benign prostate hyperplasia or other prostate problems, the following medicines are usually used to treat the list of prostatic related issues. So now Sevan Serenata is the most effective homeopathic medicine for benign prostate hyperplasia. It can be used to manage almost any symptoms of enlarged prostate gland and has given great clinical results. A frequent urge to urinate at night with difficulty in passing the urine and feel of coldness in the sexual organs suggests a need of this remedy. This is it sometimes also used in low potencies for urinary incontinence in older men. It treats, normally the Q is used, now it is like in potencies, it is used for treating incontinence of urination in older men. It treats difficulty in passing initial flow of urine where force is required to eliminate initiate urination. It addresses interrupted urination and dribbling urine. So, Sevan Serenata takes care of a variety of multiple type of symptoms related to prostate enlargement. Next is conium. Conium maculatum acts on enlarged prostate gland and other glandular systems. The symptoms is it is of difficulty in boiling urine. Urine flows and stops again. Interrupted discharge and dribbling in elderly men. So conium is one of the recommended or indicated remedy. Next is apis meth. A stinging pain during urination, and that is worse when final drops are passing in is a strong indication for this remedy. Discomfort may also involve the bladder. The bladder also may be discomfort in the bladder. Prostate area is swollen and very sensitive to touch. The person may feel worse from heat and from being in the warm rooms, with improvement from being out in open air or from cool bath. So the stinging pain indicates apis meth to be given. Next is causticum. Urine escapes when the person coughs or sneezes. Often indicates the need of this remedy. This is important, which we can remember. Most people have urinary incontinence, and when they sneeze or laugh or cough, urine escapes. So the causticum is one of the best medicine. Once urine has started passing, the person may feel pressure or a pulsation extending from the prostate to the bladder. Causticum is also indicated when sexual pleasure during orgasm is absent or diminished. So causticum is to be remembered for urine escaping while coughing or sneezing. Clematis is the remedy often indicated when swelling of prostate gland seems to have narrowed or tightened the urinary passage. So that is normally when the urinary passage the flow starts reducing, then we can think about this medicine. Urine usually emerges slowly in drops instead of stream with dribbling afterwards. Clematis. Next is lycopodium. This remedy may be helpful if urine is slow to emerge and with pressure felt in the prostate both during or after urination. It treats frequent night urination. Prostate is enlarged and impotence may also be a problem. Well, people who need this remedy often suffer from digestive problems with gas, bloating, and have energy slump in the late afternoon. So this is lycopodium. We all know it is a gastric medicine also, and also it addresses the prostate gland and sexual organs also. Varitaka effectively treats sudden urge to urinate. Effective men have to rush to pass urine when urge comes and cannot retain urine. So if he feels to urinate, he has to urinate, he cannot hold it. So Varitaka is the medicine. Burning sensation while passing urine, dribbling after urination. Increased frequency to pass urine due to above complaint. So urine cannot hold urine, has to rush to the pass urine, and burning sensation while passing urine, dribbling after urination. All these are the Varitaka symptoms. Haemophilia ambulata is often helpful when the prostate gland is enlarged with urine retention and frequent urging. Person may have feeling that a ball is lodged in the pelvic floor or experience pressure, swelling and soreness that are worsened when sitting down. The affected person should strain hard to pass urine. In extreme cases, the urine is forcefully passed by bending forward. Urine is scanty and may have foul smell. Burning sensation while passing urine can be felt. So, foul smelling urine, straining urination, chimapilla has to be remembered. Chapter this remedy is well indicated as to manage cases having a sensation that the bladder is not emptied fully after urination, that is urine retention is felt and pressure is felt even after passing urine. There is a sensation of as if a drop of urine is rolling in the urinary tract continuously. The man feels burning pain in the urinary passage even when the urine is not flowing. Urine retention is troublesome. Men who are likely to respond to stransagria are often sentimental and romantic, and they also have problems of impotence, most often caused by shyness. So these are the additional indicated tips to remember. Puja, when prostate gland is enlarged and the person has frequent urge to urinate with cutting or burning pain felt near the bladder and neck, and this remedy may bring relief. Puja is for that. After urine passes, a dribbling sensation may be felt. Forked or dividing stream. Sometimes when you pass urine, you will have, instead of one stream, you will have two streams side by side, and the forked or divided urine stream is sometimes seen when this remedy is needed. So puja for divided urine stream. And other symptoms what we mentioned now, enlarged prostate gland and cutting and burning pain in the neck of the bladder. Pulsatilla, prostate problems with discomfort after urination and pains that are extended up to the pelvis or into the bladder, often worse when the man is lying down. Suggests a need of this remedy. There may also be a bland, thick yellow discharge from the penis. Pulsatilla is usually suited for emotional individuals who want a lot of affection and feels best in open air. Purum pictricum, senile hypertrophy of prostate gland, epistaxis, frequent maturation, that is at the night, frequent urination at night with full feeling and pressure in the rectum, scanty frequent urination starting at the neck of the bladder and penis. These are for purum pictricum. Then there are patented medicines also for prostate gland enlargement, that is Dr. Redwig's R25 is also called prostate drops. SBX Postorum is also there. There are many other combination preparations by different labs and manufacturers, but I've just mentioned only two. 10 to 15 drops in 30 ml of water 3 times a day for 3 to 4 months can relieve many symptoms related to enlarged prostate gland and prostatitis. R25 and Prostano pictures are just over here to show you all. That's all. I'm stopping here now and we will continue the discussion. Thank you, sir.
Sir, Suresh Kumar sir. Suresh.
Yes, sir.
Yes, you can take, sir.
Okay. Shall I begin the session?
Yes, sir. Yes, sir.
Yes, you can talk.
Is it audible, everyone?
Yes, sir.
Very warm good evening to all the entire group, and we'll continue with the therapeutic indexes, which has been we have been discussing. Last segment we have come, so we will finish off today and then we'll take other things next class. So we stopped with the disease indication, smallpox, and we'll continue with alphabetical order. The next in series is our sore throat, very common symptoms, in our clinical conditions, and it is represented as pain or irritation in the throat, can occur with or without swallowing. There may be swallowing difficulty or may not be with the swallowing difficulties, and this may be on account of the viral infection of the throat, namely cold or flu, influenza like that. So, what are the indicated remedies for sore throat? Very commonly we think of often is belladonna. For inflammatory conditions, we always first think of belladonna. But other than belladonna, next we think of very commonly used medicine in cold and influenza is hepa. Hepa is also very good remedy for indicated conditions. Then we can think of Moxa. We can think of another acute class of aconite. Then we can think of lachesis. We can think of Baryta carb and phosphorus, as well as capsicum also. So these are some of the few important remedies or first line of remedies we can fall back on these conditions. I repeat: belladonna, aconite, hepa sulph, moxa, then lachesis, phosphorus, Baryta carb, and capsicum. The next is stomatitis. Stomatitis is an inflamed or sore mouth and can disrupt the ability to talk, ability to eat or even sleep also. So mostly it affects lips, tongue, gums, and on the throat also. So it's an inflammation of the inner cavity of the mouth, so affecting lips, tongue, gum, and throat also. So what are the important remedies in the given condition? Stomatitis. So we think of always first we think of Calymore, very common remedy. It falls under the bio category also. So we can very easily think of Calymore. After Calymore, we can always think of Argentum nitrium, because it is a prime remedy for throat also, inflammatory condition of the mouth, throat also. Then we can think of next remedy is nitric acid and borax, which are meant for the stomatitis, borax and nitric acid. After that we can think of hepa, we can think of moxa, then we can think of sorinum also. So I repeat: Calymore, then Argentum nitricum, borax, nitric acid, moxa, hepa and sorinum. So these are some of the first group or first line of defense remedies for a condition called stomatitis. Then we'll go to next disease condition, sunstroke. So it is all of us know it's a heat illness produced on account of excessive heat that results into body temperature greater than 40 degrees centigrade. So symptoms in this condition is dizziness, severe headache, acute headache, nausea, sometimes confusions also. Also, it causes the muscle cramps also. So, on account of the heat, the symptoms include dizziness, headache, nausea, confusions, as well as the muscle cramps also. So these are the symptoms of the sunstroke. So what are the important remedies for the sunstroke? So again, one of the best friend in our army for inflammatory situations is Belladonna, because is meant for all kind of inflammation, also meant for circulatory disturbances also occurring in our circulatory system. So bell we can think, but if the bell doesn't work, we always think of Glonine. Glonine is an indicated remedy for a given condition, any kind of discomforts on account of heat of the sun or particularly sunstroke. Glonine is an indicated remedy. Then we can think of Rustox, we can think of Gelsemium, Natrum Carb, then amyl nitrosome also. So these are some of the first line of remedies for we can fall back in a given condition. So for sunstrokes, I repeat, Belladonna, Glonine, then Rustox, Gelsemium, Natrum Carb, and amyl nitrosome. So these are the indicated remedies for the given condition. Then after that, next disease condition is syphilis. Syphilis is an infection caused by the bacteria. It is a sexually transmitted infection or disease. In early stages, it erupts or it causes single, small, painless sore on the skin. If it is not properly treated, it causes non-itchy skin rashes on the hands and feet, and sometimes it also leads to swelling of the lymph nodes also. So it is a bacterial infection, and basically is known as a sexually transmitted disease also. And basically its reflections and manifestations are observed in the skin as well as the lymph nodes also. So what are the medicines in the given conditions? So important remedy, all of us know, for syphilitic condition is prime remedy is your mud salt. Because when we read miasm for a syphilitic miasm, the prime remedy is always indicated as a mud salt. So apart from mud salt, what are the other remedies we can think of? Apart from mud salt, the potential remedy is arsenic album also in a given condition. Then we have got nitric acid, we have got aurum metallicum, we have got thuja, we have got kali, iodum, and then there is another remedy, a new remedy called corydalis. Corydalis is also indicated for syphilis. Very rarely used, but I've seen this remedies are specific for syphilitic condition. And then another remedy, rarely used remedy, is calantropis. So these two are also can be added to our list for the indicated condition of syphilis. So I repeat, remedies, mud salt, then arsenic album, nitric acid, aurum metallicum, thuja, kali iode, then corydalis, and calantropis. These are the important. The next we go into the series is tetanus. So tetanus, not commonly found, but we still encounter this disease in many circumstances. Mostly death in hospital is a very typical acute phenomenon. So, and it is a tetanus is caused by a toxin called bacteria called Clostridium tetani. The causative organism bacteria is known as Clostridium tetani, and it is potentially a fatal bacterial infection. We all must know it is a fatal bacterial infection. It affects it has got a greater impact on nerve centers, and it causes painful muscle contractions, particularly jaw and neck. In tetanus, the muscles of the jaw and neck is greatly affected, and if it intensifies, then it causes stopping of the breath, stopping of the ability to breathe is gets stopped, and eventually it leads to death. So it is a fatal bacterial infection, mainly affecting the central nervous system. It affects. So what are the important remedies for this situation? So the remedies for tetanus is strychnine. Strychnine is an important remedy called for this condition. Then Cicuta virosa, then Hypericum, then Nexvomica, Passiflora, Physostigma, and there is a new remedy called Upas Tinte. Spelling is UPAS, Upas TIENTE, Upas Tinte. This is also indicated remedy for the tetanus. So I repeat, the remedies: Strychnine, Cicuta, Hypericum, then Nexvomica, Passiflora, Physostigma, and Upas Tinte. So these are the important remedies as per the Medicine America also. So we can use these remedies as a first aid and take the patient immediately to the hospital, because dealing the tetanus in our clinical condition is very difficult. So we have to keep it in mind, and immediately we should rush to the hospital, and these are the remedies individually for the tetanus. And next is tonsillitis. Tonsillitis is an inflammatory situation of two oval-shaped parts of the tissues at the back of the throat, and on account of the inflammation it leads to fever, it leads to sore throat, and also pain as well as swallowing difficulties. So very common with the children, and is a pediatric type of disease, we can call it. It cannot be strictly graded as a pediatric disease, but very common with the children. What are the important remedies for the tonsillitis? So for tonsillitis we can fall back on belladonna, Muxol. Important remedy is Baraitacard, then Calcariacard, Heparsulf, Phytolacard, Calimore, then Ammonium muriaticum. So these are the first line of remedies for the given situation. Tonsillitis. For again I repeat, the important remedies for the given condition tonsillitis is belladonna, Muxol, Baraitacard, Calcariacard, Hepar, Phytolacard, Calimore, and Ammonium muriaticum. Then the next disease condition is, I'll go for toothache, very common problem, particularly with the senior citizens or with the 55 plus or 60 plus. Nowadays toothache is not only senior citizens, but nowadays it is very common with children also because decay in or infection of the gums also. So toothache is very common, and what are the remedies we can think of in case of toothache? So the first kind is belladonna, then we can think of Muxol, then we can think of coffea, then we can think of Creosotum, Plantago, Chamomilla, Hecla lava, and Medcar, also Hypericum. Let's not forget the Calendula and Hypericum trauma remedies in these conditions. So these are some of the listed remedies as a first line of defense remedies for the toothache. I repeat: belladonna, we can think belladonna first, and Muxol, coffea, Creosotum, Chamomilla, Plantago, Hecla lava, Medcar, also Hypericum, calendula. Not only this, I have found some of the recently many drops have come for external application. In those drops, I have come across some of the new remedies have been used there as a composite remedies here, and those I repeat, Oleum caryophyllum. Oleum caryophyllum mother tincture is used and indicated for the toothache. Then another remedy mother tincture is Terminalia cebula. Mother tincture, Terminalia cebula. This is also very much indicated for the toothache. And then mentholum mother tincture. Basically mentholum is meant for neuralgia type of issues, but it can be very effectively used in as a mother tincture for external application. So I repeat, these new remedies for the toothache is Oleum caryophyllum, then Terminalia cebula, and mentholum cube or mother tinctures. So these are the additional new remedies you can fall back in case of toothache for external application apart from Plantago and Creosotum. So we apply externally Plantago mother tincture and Creosotum mother tincture, but these are the other mother tinctures we can effectively use to control our toothache. Then finally we'll stop with this condition, trauma. So trauma is a very common phenomenon we encounter in a clinical condition. What are the many times we have come across in our discussion trauma remedies. Again, without going detail into that, the trauma remedies are arnica, again hemamelis, your calendula, hypericum, rota, rustox, bellis pedis, and let's not forget the ledam also. So these are the first line of defense remedies for the traumatic situation or traumatic condition. So I repeat, arnica, your hemamelis, ledam, calendula, hypericum, rustox, ruta, and bellis perineum. These are bellis perinis. So these are the trauma group of remedies we can fall back in case of need and necessity. So with this I will give a pause because it's going to 5:30. So we'll continue with the next class. Over to Dr. Murthy.
Is my voice audible?
Yes, sir.
Namaste, my dear homeopaths.
Yes, sir.
Thank you very much, Surendra sir, Anu, and Suresh sir. Excellent class we have taken. Any questions from your side? Any questions? No, all are thorough.
Very good information. So,
Shall I ask one question? Our Suresh Kumar, when he is talking about, he has told one drug, new drug, Terminalia cebula. Anybody can tell something about that one? Terminalia cebula. Of course, he has mentioned only toothache. Only toothache. It is a secondary drug for toothache. Primary is our belladonna and chamomilla. So belladonna, chamomilla, Mexal, all those things will come. We lost, everything failed means at that time we can give. But these type of people, when you want to give Terminalia cebula means they will have anus problems. The best medicine available in mother tincture anus problems, Terminalia cebula. In homeopathy we are having aloes, but frequent diarrhea, and Terminalia cebula is one of the best remedy for IBS. If you take mother tincture,
So
You can have-
terminal is Kadukai.
Kaduka, yes, Kaduka. And it will work for the respiratory also, all are secondary. Primarily only anus. It will work on constipation, it will work on frequent diarrhea, it will work on frequent dysentery, and another the most important, bleeding piles, pus formation piles. Some white discharge will come. Along with this, you can give aloes, protontic, and nitric acid. These three are in homeopathy. This is mother tincture. You can take this one along with kurchi, Kurchy, kurchi. That is also one of the best remedy for dysentery and diarrhea. IBS medicines, kurchi and terminalia. You can take 3 drops only. You should not take more. So one of the best remedy what he has told. Of course, our Suraj Kumar is bringing new drugs whenever he is taking class. Please go through. You will have an idea on this. Whether you will tell somebody or not, you will have an idea on this. And so many of he has told, Upas he has told, that those things not necessary, but terminalia is one of the best remedy for anus-oriented diseases. If it is a dysentery or diarrhea, you can add with this 3 drops of kurchi, kurchi, and terminalia chubula. So, Anup Kumar sir, time is over.
Okay.
Thank you.
Thank you everybody, and we'll meet in the next class.
Okay sir, thank you very much. We'll meet in the next class. Thank you.
Thank you.
Thank you, sir.
Thank you, sir. Thank you very much, sir.
Namaskar, sir.
Thank you, sir.